Hi, I am Dr. Thilagavathy, consultant pulmonologist in Vijaya Group of Hospitals. My specialty is to deal with lung disorders and sleep disorders. The ideal approach to sleep disorders are starting from history. So, if you have any disturbance in your sleep, you are not able to sleep well, or you have daytime somnolence, or you are sleepy all the time, you are not able to concentrate on work, even if you have uncontrolled blood pressure or uncontrolled diabetes, that also can be an early sign of sleep disorder. So you need to be, if you're not able to concentrate, you have any symptoms which you are not able to find a definite cause, then you are at risk for sleep disorders. So only a sleep study can help you diagnose a sleep disorder. So in sleep disorders, we have different various approaches, and it is a multidisciplinary approach. You can have a central sleep disorder called central sleep apnea, or you can have obstructive or peripheral sleep apnea, which is related to the lung, and then you can have psychological issues which are related to sleep disorder. So it is a teamwork between a neurologist, pulmonologist, and a psychiatrist. The other issue with sleep is generally in the younger generation, people who are having an increased screen time can also have sleep disorder, which will go mostly undiagnosed until later in life. They present with uncontrolled diabetes, hypertension, obesity, and issues like that. So if you have any doubt or any of these symptoms, or you have some doubt whether you are suffering from a sleep disorder, the ideal approach should be to have a polysomnography or a overnight sleep study. The challenge in sleep disorders are people refuse to believe that they have a sleep problem, or after coming they don't know which doctor to approach or which specialty to go to. So that is the first challenge we have. Once they overcome this challenge and they come to us, I think sleep study helps you to diagnose which part of the sleep you're lacking, or whether it is central or it is obstructive, and then other issues like obesity and other health related issues. So when you come to a doctor during this COVID time, patients don't come to us because they are scared that they will acquire COVID from the hospital. So they try to postpone the problems till it comes to a oven bursting stage, where they come to us very late, almost in cardiac failure, with right heart failure, in the ICU, and so many issues. So COVID, I think home sleep study is a better option than a sleep lab during this COVID times, whereas our approach was very different pre-COVID era. We used to subject everybody to a proper sleep study in a proper sleep lab, which is all I think we should work with a compromise, so that home sleep study can give us a better, at least identify these patients early, and not to see them in the ICUs and treat them as OP. Home health care, in fact, has improved during the COVID times. I think everybody is opting for home health care nowadays. They want the entire hospital at home. There are patients who have entire hospital at home, ICU at home. They take so much of medicines, care, and NIV support, which is one of the mainstay of treatment for the sleep disorders at home. Even before COVID times, this sleep disorders were treated in the home using NIVs. Now, after the COVID era, I think it has aggravated to a great extent, that every care related to sleep is being given online or at home. So these patients can be treated very well on online consultation as well as at home. And NIV issues, non-invasive ventilation, CPAP, BiPAP, oxygen support, all these can be improvised at home and on online consultation itself. So do not hesitate to come early and take proper instructions early. Specific sleep devices used for the treatment of sleep apnea is tailored to each and every patient. There are tests which we need to decide, like we have a complete overnight sleep study, arterial blood gases, look at the PCO2, their obesity level, and so many other factors which decide on which NIV to institute for which patient. So it is based on all these factors, it is very much individualized. So if you have a central as well as a obstructive sleep apnea, then the choice of the NIV becomes entirely different. So it's a factor which is decided by a pulmonologist and a neurologist along with psychiatric consultation. People with sleep disorders have triple the risk of COVID complications, and they land up in the ICU more often compared to the other public. During this COVID times, sleep disorders have worsened the COVID complications, and they are at increased risk of cardiovascular complications associated with COVID also.